Let's bring in Dr. Christopher Labos, who is listening there to Christine's report, and he's going to talk further about those guidelines. He's an epidemiologist and cardiologist, and he's in Montreal. Good morning, Dr. Labos.
Good morning. Good morning.
Listening to Christine, I mean, many things stood out, but one was just really how striking it is the hold smoking has. Even we talk about it all the time, the health risks. 48,000 preventable deaths a year, the leading cause of death and disease in Canada every year. That stands out in terms of, the reality we want to tackle here.
Right. And I mean, at this point, I don't think there's anybody in Canada or around the world that thinks or that doesn't realize the dangers that cigarettes have, right? If you went back to the 1950s, 1960s, it was possible to be ignorant about the health effects of smoking, which is why a lot of people took it up. Today, I think everybody who smokes a cigarette understands that it is bad for them, that it is going to shorten their life. And yet they continue to do it because it's addictive. It is an addictive substance that people just can't quit. And it has a major toll on our healthcare system. Even today, when the number of people who smoke is relatively low compared to the historical past, somewhere between 10 and 15% of the population, it still has a major impact in terms of a lot of these chronic diseases that really cost a lot to the healthcare system, namely lung cancer and cardiovascular disease like heart attacks and strokes.
And cost lives too. So into this reality is this range, this first ever national guideline. What do you think is the value of what's been published?
Well, I think the value is really just providing sort of a summary document for the various options that are out there. Because I think a lot of people are still under the impression that they have to quit cold turkey. And, yes, obviously, a lot of the decision has to come from you. People have to want to quit. You can't force them to quit. But if you do want to quit, there are a number of options available to you, both pharmacological and non-pharmacological. So there's a lot of the counseling support services that exist in various places across this country that do help. There is evidence that they help. And there's a number of pharmacological options that will help you quit smoking. And while quitting smoking is very, very tough, Mark Twain had the famous quote, "Quitting smoking is easy. I've done it many times." A lot of people are going to quit, relapse, quit again, and it does take most people several tries to really do it definitively. And while it is very, very tough, your odds of success are going to be a little bit higher with some of these medication options.
What doesn't work, and this is interesting, and Christine's report points that out, part of what has prompted this national guideline now is to counter the mis and disinformation that's out there on social media, the things that don't work. Now, Christine makes the point that it may, there may be some anecdotal evidence of some relief. But by and large, it's quite a range of things from acupuncture right on through to St. John's wort that doesn't have that kind of evidence-based relief.
Right. And I think the warning here is you got to tell people, look, don't spend your money on stuff that isn't proven to be effective. Spend your money on stuff that is going to be effective, or even better, make use a lot of the hospital-based services, especially the counseling, the support groups that do exist. Because a lot of these things that was mentioned in the reports, they are privately done, right? They cost money. And in a day and age where money is tight, don't waste your money on stuff that isn't going to make a difference. We know what works. We know what doesn't. Spend your money on the stuff that actually does work.
The one point that stands out as well is how the report and how the guideline addresses vaping or e-cigarettes. And it does say it could be a tool for those who are not able to quit in other ways, but really that it warrants further study because we still don't understand the health implications of all of that. Where do you fall in terms of vaping and e-cigarettes to build on what we're reading on in this guideline?
Yeah, I think I do largely agree with the guidelines. I have certain I have certain reservations about e-cigarettes. They have been studied as a smoking cessation aid, and they can be used in that context, even though they are actually not approved by Health Canada for that process officially. Because fundamentally, an e-cigarette is just a nicotine replacement device. It is, still delivering nicotine to you. Rather, it's just instead of as a patch or as a gum, you're getting it as an inhalation. The problem is the societal implications of it, the normalization of smoking, the making it appealing to kids, the flavored e-cigarettes that are out there that are potentially addictive. So I think there are a lot of ancillary problems with it. And when you look at the evidence, while it does work, it is roughly comparable with some of the other therapies that are out there. So why not choose the stuff that is probably cheaper, equally effective, and doesn't have the same potential long-term complications?
Dr. Labos, thank you as always. See you next week.
My pleasure. You take care.
This is CBC Morning Live.